Hello everyone and welcome to our video about Stockport Virtual Ward. My name is Dr. Lindsay Brandwood. I am a GP and I've been working with the Stockport Virtual Ward since September 2023.
Hello, my name is Katie Costello and I'm an advanced clinical practitioner working with both the Virtual Ward Service and the Urgent Community Response Service.
And we are really passionate about our virtual ward. We know lots about it, we know about the benefits, but we understand that sometimes our colleagues in the community, GPs and other people that refer into us don't always understand everything about what we do. So the purpose of this video is to try and give you a bit more information, help you understand what we can do for you and what we can do more importantly for your patients. And also just to let you know a bit more about our inclusion exclusion criteria. Sometimes you'll hear virtual ward, other times you might hear the phrase hospital at home. Essentially they're the same thing.
So hopefully in the time it takes you to have a quick cup of tea today, we can give you a clearer picture of how our virtual ward works, what we can help you with, and answer some of the more common questions that we hear from GPs within the Stockport area.
Okay, so let's start with the basics. What is a virtual ward? So the NHS defines a virtual ward as a safe, efficient alternative to bedded hospital care enabled by technology.
And from our experience, that absolutely holds up. Patients are monitored closely, have access to that clinical support they need, but also can recover in their own homes.
And it's really reassuring for them to be in their own home but have that additional reassurance that someone is looking at their health, that they've still got the observations and that someone's checking in with them regularly. It supports their overall well-being. We've seen firsthand how being in their own environment really supports that healing process. They're surrounded by family members, pets if they've got them at home, and it really boosts their physical and mental well-being.
Plus, let's not forget that a too long a stay in hospital can lead to deconditioning, loss of confidence, loss of muscle strength and mobility, which makes it more difficult to bounce back from. Virtual wards can help patients avoid that by making sure that they do get the medical support they need at home.
Moving on to common questions about the virtual ward. So one of the main questions we get asked from GPs is who is suitable for the virtual ward. So we accept patients who've got a Stockport GP who are over the age of 18.
We also have specific clinical pathways including acute respiratory infection, frailty, heart failure, general medical and DVT. There's also step-down options from the hospital including our postnatal hypertension pathway and our oxygen weaning pathway.
And when we get step-up referrals from yourselves or from other community services, then we would like you to have that conversation with your patient. You know, you're thinking that they might need admission, you're worried about them, you will make a clinical assessment as to whether virtual ward might be appropriate for them, and then have that discussion. Is it patient preference? Are there things that would make staying at home for this patient really important? Social factors, responsibilities, pets, etc.
It's helpful at the point of referral as well if we are given a clear handover about what you may be worried about and also what you'd like us to monitor. But rest assured, once the referral is received, the virtual ward team will take over the care for that condition, including the reviewing bloods and prescribing.
And once you've agreed that admission to the virtual ward is appropriate, you would then call our single point of access on 0161 204 4777 and choose option 2. We do have some exclusion criteria, so things to be aware of. So if the patient is under 18, if they don't have a Stockport GP, if they have a new acute oxygen requirement, if you suspect sepsis, you need to get them to hospital quickly, if they have a new score of 5 or above, or if they have any significant mental health problem that would mean monitoring them at home was unsafe, or a significant substance abuse problem that would mean that monitoring them at home was not possible or impractical.
And a small side note about the News 2 score, because some GPs have asked us about this, there is an e-learning for health module on News in the primary care that is really helpful. However, if a GP doesn't have a formal News 2 score, we still value their clinical judgment if observations are documented.
So moving on to communication, GPs often wonder how are they going to stay in the loop about their patient while they're on the virtual ward. So when a patient is referred to us, you will get a letter that will be emailed out to you to tell you they've been onboarded to the virtual ward and that they're under our care. When that patient is then discharged from the virtual ward, you will receive a summary of care document that outlines briefly what's happened and will outline any medication changes and any actions that we think we need to know about.
Both forms are designed to be short and to the point. However, do rest assured, if there was any urgent matters, we would call the practice and speak to the duty GP if needed, although that's not common practice.
And yes, you can access all of our documentation. It's on EMIS, and all you have to do is select the Community Services tab, and you can have a read. And we actively encourage you to do that. If you've referred a patient to us, or if you have a patient that comes to see you that tells you they've been under our care, please do go on there and have a look. It will give you a much clearer idea of what we do here on the virtual ward.
So next up, we're talking about technology and staffing. In terms of technology, we use a device called a Dockphone. It's simple. Patients, carers, or family members are able to input their observations up to 4 times a day, depending on the clinical need.
And a care support worker from our team goes out to the patient's home, sets the equipment up, does the first set of obs, shows the patient or their carer how to use the equipment. And you know, people often worry how are older patients going to manage. On the whole, we find that people manage really well, often better than expected. If they're not able to put it into the machine, but they can do the obs, then we can take those results over the phone. And if really needed, then we could send someone out to do them. But often patients feel really part of their care when they're doing some of their own observations and feel empowered by that.
So in terms of staffing, our team is made up of a wide selection of the multidisciplinary team, including GPs, advanced clinical practitioners, a nurse consultant, and also Band 6 nurses who monitor the data via the digital health service. If needed, we can also work closely with the urgent community response team and other community services for more proactive support, including face-to-face visits if it was felt there was a clinical need to do so.
So moving on to how we arrange diagnostics and what we do in emergencies. So we can do bloods for our patients daily if needed. We can do ECGs and other point of care tests in the patient's home that all get reported the same day. If we need to send them into the hospital for something that can only be done there, like a chest x-ray or like a Doppler ultrasound, for example, for our DVT patients, then we can arrange patient transport if needed, or the family can get the patient to the hospital if required.
If a patient does, however, worsen on our service, all clinicians follow a standard escalation pathway. The virtual ward team may arrange for an urgent community response clinician to visit or include a senior clinician to review remotely. And of course, if needed, we'll always initiate a hospital transfer via the 999 service.
In addition to our regular contact to the patient can contact our team. They're given a phone number and they can contact between 8 AM and 8 PM each day. Outside of those hours, they have an information leaflet that will instruct them to call NHS 111 or 999 in the case of an emergency. For the most part, patients are so well looked after in the daytime that often things can wait till the next day, but they're very well briefed on how to access emergency care out of hours if they need to.
So, in a nutshell, the virtual ward is here to support you, your patients, and the wider health system. It's safe, effective, and most importantly, centred around patient choice and recovery.
Thank you very much for listening. I've here got a copy of our referral poster. If you'd like more information or a copy of this, please do get in contact with us. We're likely to send you out a copy of this with this video anyway, and this will cover all of our referral pathways, inclusion criteria and exclusion criteria, and importantly it has that referral number on the bottom.
And I suppose the final message would be, if you're a GP in Stockport and ever find yourself wondering, is there an effective, safe way to manage this patient at home, please do give the virtual ward service a call and discuss that patient with us.
Thank you so much for your time. Thank you.